Good evening, everyone. My name is Mike Pilcher. I'm the president of the North Nevada Central Labor Council. And thank you for joining us tonight for a night of COVID vaccine education. By now, it should be clear to everyone in our community that a healthy economy, a healthy and open economy, is critically dependent upon a healthy workforce and healthy consumers. So to help us address the COVID vaccination crossroads, which you may be at, which some of your members or family may be at, we have a panel tonight of 3 experts, and I'd like to read you their bios. They're kind of humble, and they shouldn't be. They have outstanding backgrounds. I'd like to introduce to you Dr. Bayo Curry Winchell. Dr. Curry Winchell obtained her medical degree at Ross University and completed a residency at University of Nevada, Reno, family medicine. She is currently both a practicing physician and medical director of St. Mary's Urgent Care Clinics. She is also the medical director for the Washoe County Sexual Assault Response Team and volunteers as an assistant medical examiner for Washoe County Child Protective Services. Before becoming a physician, Dr. Curry Winchell received a master's degree in physical assistance studies from Marietta, Ohio. In addition to her clinical work, Dr. Curry Winchell is a member of the Nevada Academy of Family Physicians, the American Academy of Family Physicians, a board member and PR chair for the Washoe County Medical Society, and board member of the Nevada State Medical Association. With passion and dedication to caring for and improving her community, she received the 2020 PBS Reno Spotlight Extraordinary Neighbor Award. Dr. Curry Winchell is an active member of the Young Professionals Network, being awarded one of the 2018's top 20 under 40 brightest leaders in Reno, Tahoe. She was named Sierra Nevada Top 20 Most Powerful Women in 2019, and she participated in USA Today's One Nation Healthcare panel in 2016. So we are excited to have her. Along with Dr. Curry Winchell is Dr. John Hess. Dr. John Hess is a board certified physician in the specialty of family practice, has been in practice in the Reno area since 1998, a native Nevadan. Grew up in Carson City, graduated University of Nevada, Reno, School of Medicine, did residency in Redding, California through the University of California, Davis. Finished residency, relocated back here, and practiced medicine with renown until 2015. In 2009, was awarded Family Physician of the Year. Moved his practice to St. Mary's and subsequently became the medical director of primary care for St. Mary's Medical Group until this year. Recently left and joined several other physicians in forming a brand new primary medical group throughout the Reno Sparks community called Pinnacle Medical Group. And he has been honored to serve on the City of Reno's COVID task force during this pandemic. Bringing up the rear is no slouch, Dr. Ron Aryel. A pediatrician with background in disaster medicine and biosurveillance. For 11 years, he ran the Reno Center for Child and Adolescent Health, specializing in the most highly complex cases, special needs kids, young adults, any of the sickest children in Reno. His practice won awards for outstanding care from Drexel University, and in 2018 from the United States Senator Dean Heller, in April of 2016, where the tribute was read into the congressional record on the floor of the United States Senate. Immunize Nevada recognized the Reno Center for Child and Adolescent Health for its very high vaccine rates. Dr. Aryel was a key subcontractor for and helped develop the United States' first biosurveillance, bioterrorism, man-made epidemic detection system called RODS, which was used here in Washoe County, among many other places. He's a member of the City of Reno's COVID task force, a member of the working group that created the COVID risk meter here locally. He led the development of a predictive tool, which so far has been proved extremely accurate in forecasting the pandemic locally in Washoe County. You can see it at www.covidriskmeter.org. And the idea came to him from his previous job in aerospace. I don't know what he does with his free time. Maybe he's pursuing another PhD. So welcome to our panel. So before I let you guys start this conversation off and tell us a little bit about why you're here, the safety and efficacy and the creation of COVID, I'd like to thank Sarah Mahler. Her timing was spectacular. Our board of trustees and labor was concerned about our workforce getting back to work, and we were concerned about how the vaccine would be received among our own members, participation. And Sarah Mahler reached out to us and introduced us to you. So I got to give kudos to Sarah. So thank you very, very much, Sarah, if you're listening. Doctors, please take it away.
All right. Well, John, would you like to head off with kind of the state of the vaccination right now and the vaccination program, because you're closer to the actual administration end of it, and then Bayo could follow up with that, and I'll lead up the rear.
Absolutely. Certainly, we're happy to answer questions about the vaccine development. We could certainly get into that down the line. As far as current vaccine, as I think most people on the call are aware, there are two FDA approved emergency authorization use approved vaccines, one from Moderna, the other from Pfizer. Currently in Washoe County, they're getting shipments of both vaccines on a regular basis. The amount of vaccine that comes with each shipment does vary depending on the supply that's being provided by the federal government. So the federal government basically allocates a certain amount based off of population to each state. Then each state distributes it further out from there. As I think most are aware, initially they've broken it down into tiers. Tier 1 being healthcare providers, and then tier 2 is where we're now in, where you're seeing people over the age of 70, along with other people that are considered critical infrastructure. Initially, when they put these tiers together, they were everybody's kind of lumped together. What they've more recently done is made subsets within the tiers. And so right now we're at the beginning of tier 1, which is healthcare workers that have not yet been vaccinated, because there's still some out there. You've got now people over 70. And then you've also got the start of the critical infrastructure, which they've put education at the top of that list. And then they're going to work down from there. So if you look at the amount of vaccinations that have been actually given in Washoe County, the health department has given out, I think it's like 12,000 doses so far. And then, but there's also doses that have gone directly to the various hospital systems in town. So Northern Nevada, Carson Tahoe, Reno, St. Mary's all got allotment as well. All of those doses are getting inputted back into the system because they have to be, they have to track them. But when the county releases the numbers, they're only releasing the numbers that they have given. So the numbers that the individual entities have given is a little bit unknown, but I would say it's at least double the number that the county has given. So we're probably currently in Washoe County somewhere in the range of 20 to 30,000 people that have gotten their first dose. A much smaller percentage has gotten their second dose, and those doses for the people that got the Pfizer vaccine, I think they're about 10. Well, Bayo, you were in that first group. How long has it been since your second dose?
So I received my second dose 2 weeks ago. So that's the time frame, about 2 weeks ago.
And just so people know, I'm getting my second dose on Monday. So we're working through it. One of the questions that comes up is, where I got my first dose, where do I get my second dose? Right now, it's basically whoever gave you that first dose is responsible to give you the second dose. And there's a lot of questions and people are worried, I think, about supply. Is there going to be enough to get that second dose? There's been a lot of reassurances that even though I'm sure you've seen in the media where they released all of the available supply or all the supply that was made has gone out, production has been able to keep up, so that that we're getting reassurances that those second doses will be available when the time it comes. Keeping in mind the two vaccines are different. The Pfizer is 3 weeks after the first dose. Moderna is 4 weeks. So that's kind of the state of where we're at right now in Washoe County. Bayo, do you want to add anything to that?
Well, I can kind of lead into, what to expect and what symptoms you might actually experience. And so when you do sign up, of course, as Dr. Hess mentioned, you'll have two doses, depending upon 3 weeks or 4 weeks with Pfizer or Moderna. And so the most common side effects, and I actually don't like to call them side effects, I like to use what Dr. Aryel states, it's a rehearsal for your body. And so I'm going to list them, and feel free, like we talked about in the chat section, if you have more questions, I'm happy to kind of elaborate on it. The most common symptoms that you will feel will be a headache, a low-grade fever, body aches, and fatigue. And why we use the word rehearsal, it's your body's fighting, your immune system kind of gearing up for responding to that. And so although these side effects are, uncomfortable, they're temporary. And I think that's the biggest thing to remember, because when you think of overall of having these side effects for a day or two versus actually catching COVID, it's definitely worth the 1 to 2 days of being uncomfortable. So those are the most common side effects that you will feel. Now, after your second dose, it's also important to remember that it still takes about a week or two for that full immunity to actually set in. And so a common question I hear from my patients are, once I get my 2 vaccines, do I have to continue to adhere to social distancing, wearing a mask, and hand hygiene? And so I like to start off with number one, hand hygiene should always be there, no matter what, pre and post, keep with that. So I think that's a good thing. As far as mask, it's important to remember that the data is unknown as far as if you are able to transmit that to somebody else. So you could be a carrier. And so that's why we are recommending that you still wear a mask and social distance until we actually obtain a high level of vaccination status in your state or wherever you're at. So those are the common side effects. Those are things to really keep in mind after you receive the vaccine. And then I'll go ahead and pitch it to Dr. Aryel.
Well, thank you very much to my two illustrious colleagues. It's important to, one thing I would ask also of all your members, well, first of all, go get the vaccine when it's offered, get both doses. And when you do, remember your body is rehearsing, so you don't want to do anything to interfere with that. What I have recommended for all vaccines to my patients in the pediatric practice, as well as to adults, is when you have side effects, if at all possible, don't take anything. Don't take ibuprofen or Tylenol before you get the shot. Don't take ibuprofen, and try not to take Tylenol immediately after the shot. Why is that? Because ibuprofen reduces inflammation, and inflammation is what gives you the protection after you get a vaccine. So if you interfere with the inflammation, you're going to make the vaccine less effective, and you're not going to be as immune as you would be had you just allowed the vaccine to do its job. I recognize that it's uncomfortable. If you absolutely can't stand it, and it's 2 or 3 days, and you've got the chills and the shivers, and you haven't slept all night because of it, because yours happens to be particularly bad, you could take a Tylenol and see if that helps you. Stay away from the ibuprofen. Write it out, tough it out, and just get through it. Most of you won't have bad side effects. Most of you will have some side effects, because the data show that 67%, something like 60 to 70% of everybody gets something. But if you can manage to just deal with it, try to do that, and in a couple of days it'll be over with, and then you'll get maximum protection for it. And that goes for anything. That goes, you get your flu shot, do that. You get your pneumonia shot, do that. Let the body do its job.
One of the things I'd like to dovetail on that is for your members that are over the age of 50 and may have gotten the shingles vaccine. I've had a lot of coworkers and people that have had both the shingles vaccine and the COVID vaccine. And a lot of people have said to me that the shingles vaccine was worse than the COVID vaccine as far as these immune reaction side effects. So, or at least it's on par. So, we talk a lot about, expect a sore arm, expect redness, expect body aches, expect low grade, chills and fever and things, but really it's not beyond what we see with other vaccines. So this is not, it's not a dramatic difference for most people compared to other vaccines that we currently are giving people.
Very good. We have a couple of Q&As, a couple of questions from the audience. Would now be a good time, doctors? Okay, this is from Beverly, doctors, and Beverly asked, how safe is the vaccine? And I think you answered this, the second part of her question, when will we see the side effects?
Well, first of all, the vaccine is very safe. 70,000 volunteers participated in the combined trials for both the Pfizer and Moderna vaccines. Very few of them had any really serious adverse effects. Side effects were common, or the rehearsals, evidence for the rehearsals were common, but serious effects that required, hospitalization or required immediate attention by a doctor were extremely rare. There are a few people who reacted to polyethylene glycol. Polyethylene glycol is a common ingredient in bowel prep when you go to get your colonoscopy. And if you're constipated, then you want to take a laxative, it's in a product called Miralax. If you're allergic to that, you may have an allergic reaction to this vaccine because it's part of the carrier fluid. But if you're not, there's very little chance you're going to react to this vaccine. It's kind of minuscule. A very tiny handful of people have had allergic reactions to the vaccine. They were people with known problems with allergies. They were allergic to things. They had EpiPens with them, epinephrine that was already prescribed for them. And when this tiny handful had that reaction, they were treated in the doctor's office or in the vaccine clinic immediately with epinephrine and recovered. I think there was one case of somebody who was hospitalized, but I'm not clear on whether the vaccine was actually the cause of that.
Well, and I'd like to add, now that we've had over, I think it's now 13 million doses that have been given in the United States of either Pfizer or Moderna, we're having good now we're being able to do surveillance, right? And sort of see outside of the original studies, what might be showing up that's statistically more common than we would expect. And the one thing, as Dr. Aryel mentioned, in fact, the only thing that has been statistically seen to be at a higher rate than we see with other vaccinations is the allergic reactions, the anaphylaxis. And if you want to look at that rate, just so you know, is 11 people per million, compared to 1 to 2 per million with the flu shot that we see. So yes, it's a 10-fold increase, but it's still a very small percentage, okay? And none of those people, and when you multiply that out, have actually died from the anaphylaxis. They've all been treated and done fine. So if you have a history of a lot of allergies, you may want to consider not getting the vaccine, although if you can, that's part of the reason why everybody who's given the vaccine must be monitored for at least 15 minutes to make sure they don't have a reaction. And the risk of having, a mortality or dying from an anaphylactic reaction, just so you know, in a controlled setting is 0.3%. So if you do the math on this, the likelihood of actually dying from the vaccine related to an allergic reaction is infinitesimally small compared to the risk of dying or having a major complication from actual COVID, which is relatively high. The mortality rate right now for COVID, depending on age, is between 0.5% and 2%. And the risk of having either hospitalization or a major longstanding complication, whether it be heart-related issues or lung-related issues or brain fog or whatever the chronic illness may be, is in the ballpark of 5 to 20%. So depending on your age and risk factors. So we're talking orders of magnitude, of major magnitude difference between that risk of allergic reaction versus significant complication risks related to actual COVID infection.
If we used natural immunity or exposed everybody to the disease and waited for everybody to become immune from the disease, as opposed to using a vaccine, it's estimated that there would be between 5 and 6 million people dead from that in the United States. So we don't want to go there.
No.
And I think a common question why people always wonder, is this safe, is because of the speed of the vaccine, how fast it was developed. And so I think a way to think about it is, in the past with measles and polio, it wasn't as prevalent. So it took several years to really develop the vaccine. Unfortunately, with COVID-19, it was so prevalent that they were able to have a large sample, if not equivalent or better than you've had in other diseases. So that may help you kind of think, oh, even though this was developed quickly, it did not lack any sort of safety. And from a personal standpoint, when Dr. Aryel and Dr. Hess were talking about the complications that we see, I see often patients who have actually contracted COVID-19, they come back and they have the brain fog, they have the neurological complications that occur. They even have, and this is something that I've really tried to stress, we all have heard about loss of taste and smell. And we tend to kind of like, oh, that's not a bad thing. But you can imagine if that has remained, and it is an amazing pleasure in life. And if you have lost that, that really can affect your outlook on life. So those are kind of some of the things to think about if they're actually permanent, some of the complications from COVID-19 that could really affect your everyday life.
Wow.
I want to throw in just one more comment to follow up on Dr. Curry Winchell. When I was a medical student, I had a very traditional medical education. The first semester I was in gross anatomy. I was dissecting bodies. That was how you learned anatomy. And of course, there was a lot of formaldehyde there. For something like 15 weeks, everything smelled and tasted like formaldehyde. I'd go to a diner and I'd eat fish and chips, and it all tasted like formaldehyde. I'd eat a hamburger, it tasted like formaldehyde. I go to my house and go to my apartment, and my roommate was using lemon scent to freshen up, and it smelled like formaldehyde. Imagine living like that for 6 months, and I knew it would end eventually, but man, I was this was not good.
So doctors, just in a nutshell, is the long-term potential side effects of COVID greatly outweigh any short-term side effects of the vaccination. And certainly the long-term threat of death from COVID outweighs any of the short-term side effects of the vaccination. Does that sound about right?
Yes.
Okay, great. Our next question, doctors, is from Marcy, and she asks, what about children? Is there a vaccine in the works for them? Is COVID expected to continue to spread without the children being vaccinated? And what age would that be?
Well, vaccine right now is approved for anybody above the age of 12, if I recall correctly. And I don't know if there are phase 4 trials underway to expand that to children. I hope that that's going to happen. For right now, it's the adults have to get the shots. The adults and the young adults have to get the shots. And if we do that and then protect the kids from exposure, that should get the job done. I'm in favor of testing this vaccine on children and making sure that children can get it too. But short of that, we can still protect the kids. If everybody, for example, if everybody's 16 and up were to get the shots, and we protected the kids from exposure, that would pretty much get the job done, I would think.
Okay, so like the mask question, Doc, we don't have the data yet. It's still an unknown. Okay.
I'll dovetail that because I was just doing some reading on this. So Pfizer's approved down to 16, Moderna's approved down to 18. They are doing ongoing studies of both in children. They have been approved to do phase 3 trials. So I would bet sometime in the next several months, those will be completed. And I would be shocked if it's not shown to be safe and effective in kids as well. Keeping in mind, we do have a risk stratification structure in this society as far as how we deliver the vaccines. And while serious complications can occur in children, and we would prefer children to not get it and certainly not spread it. That's probably the biggest issue with kids and teenagers, is not so much them getting it, it's them getting it, having mild or asymptomatic disease, and then spreading it to others. That's probably the far greater concern. But I do think eventually, yes, it will be approved in children, but we're looking at several months away.
Okay, thank you, doctors. Our next question comes from Brad, and it's a logistical question. And I believe it's the two parallel tracks that we have, and it's an age group question. What is the current age priority? Is it 70 plus? Is it over 70, 65? What is it? Can you clarify for us?
The CDC has recommended 65 and above, but we don't have enough vaccine to do 65 and above at the moment. I'm going to defer to my other colleagues to continue this.
It's exactly right. Ideally, it should be 65 and above in that first tier. And you actually are seeing some states doing that. And so this is a little bit where there's guidelines and then there's what are you getting in actual supply. So I think the states on some level, depending on how big your state is and your allotments, are adjusting their rules out on the fly, to be honest with you. And initially we started off, it was 80 and older, and then they dropped it to 70. And now you're seeing some states at 65. I think you're going to see that number continue to fall as supply increases.
Okay, very good. Our next question is from Lonnie, and I had a similar thought as well as Lonnie did. There's invitations online to sign up, and one of them is through MyChart, through Renown. I believe there's another parallel path through the Washington County Health Department, but they're allowing patients to, or potential citizens to sign up of certain age groups to make appointments, but then they're canceled. Is that due to the availability of the vaccine? Why do they do that if there's no availability? Are they just trying to get ahead of it, the curve here?
Yeah, I think a lot of it has to do with supply. I think, unfortunately, the county and the state are only a few days. They only get notification of exactly how much they're going to get a few days. So they make estimations on based on what we got last week, based on what we got 5 days ago, because it comes in batches. But then maybe the batch isn't as much as they thought they were going to get. So I think that's why you see those cancellations occur. I did just see, and I was trying to look it up. There's actually signups that are, go on to the next question, but there's a couple other places that are now signing people up. Walgreens and another entity in town that I just saw are now starting to sign people up. I'll get back to that in a moment.
Okay, doctor, thank you.
Smith's, Walgreens, and Community Health Alliance just released appointments for today. Moving forward.
Smith's, Community Health Alliance, and Walgreens. Is that correct? Okay, thank you very much. And doctor, your supply and demand answer, I think, is perfect. I remember reading recently about some doctors or a doctors group that came under pressure about jumping the line when, at the end of the day, when everything was investigated, the doses would come into a vial. They got more than they thought, and they didn't have enough people signed up. So rather than waste these vials that have to be stored at sub-zero temperatures, they said, call everybody you can. We've got to put this in people's arms rather than throw it away. So am I dancing around the correct type of administration of this vaccine a little bit? Is that your understanding as well?
It's absolutely true with the Pfizer vaccine. So once the Pfizer vaccine is defrosted, you have a very narrow window when all that dose can be given. It cannot be refrigerated or refrozen. Moderna's can at least be refrigerated for 30 days once it's been thawed. So, you can kind of not necessarily use it all at once, but Pfizer's, you got to use it within hours of the time. So yes, you'll see these incidences where it looks like people jumped the line, but what happened is they didn't have as, many people get vaccinated, or some people didn't show up, or whatever it is, and they've got doses, and they, rather than wasting it, they just soon give it to anybody that they can. I've had people reach out to me like, can I get on a list for that? Can I, be that person? I don't know how to do that. I wish I did. I don't know if Ron or Bayo has any thoughts on that, but I haven't heard of a way to get on that list.
Maybe this is their way of developing the list, the community, through the health department and Renown. That alternate type list, let's start prioritizing. Is that a possibility?
Yeah, so well, I can give you an example. This Saturday, we actually did a vaccine drive-through clinic. So we vaccinated 620 patients in 4.5 hours. And what we did was we ended up having, thank you, it was amazing.
Awesome.
We had extra left over. So we actually called Washoe County and we received the names of patients who were on the wait list. And so we just started making phone calls and just went to the next person and so forth. So we actually utilized their wait list, and we were able to get at least maybe 50 people off the wait list from Washoe County, and they received their vaccine on Saturday.
Wow, that's outstanding.
So
Outstanding.
sign up through the health department if you can. If you, I think that's a great backup.
Okay. Our next question comes from Dave. Are there vaccines available in doctors' offices yet? If not, is there a timeline for this to happen, or is that part of the plan?
I'll answer that one. It's part of the plan. Currently, no, because supply is so limited and because storage is such an issue. Certainly for the Pfizer product, no doctor's office is equipped to be able to store that. Moderna is a little easier to store, but once again, the supply is being very heavily regulated by the federal government, the state, and then the county. There are plans in place, however. Both the two newer products that'll probably get approved within the next month or two, the Johnson & Johnson product and the Astrazeneca product, do not require the significant storage. There is talk, although I don't know if it's formalized yet, that those doses may actually be able to go out to doctors' offices and be stored with regular vaccines. But currently, as of right now, no, you can't get into your doctor's office and get it.
Okay. And that was one of our questions that came up at one of our meetings previously. How long has Johnson & Johnson and AstraZeneca been making vaccines versus Pfizer and Moderna?
Well, AstraZeneca is new to the vaccine business. AstraZeneca is more known for heart drugs and cancer drugs. They're new to the vaccine business, but they hire. Well, you don't do it fresh up with your own people. You hire people who are experts and veterans at it. So they created a unit. They created a unit to make these vaccines, and the people who work in their unit have years or decades of experience. They haven't worked for AstraZeneca before, but they've done this before.
Okay. There was some concern amongst our members that maybe, Milton Bradley or Hasbro was in a race to get a vaccine out just to make money. So thanks for clearing that up for us, doctors. Our next question comes from Liz, who says that she has one daughter that had the vaccine first and a second dosage and no side effects. The other daughter has had the first vaccine and she had every side effect you just mentioned, but she had COVID prior to this. Have you found that people that have had COVID and get the vaccine are more prone to side effects?
I don't know anybody who has. Maybe my colleagues know a few people who've had that. Bayo?
Yes, we are seeing that. So those who have actually contracted COVID-19 and then received the vaccination, we are seeing a more amplified response of side effects. We're seeing what we call lymphadenopathy, so enlargement of the lymph nodes on the side of the arm that was injected in the armpit, a severe headache. Some people have also stated just fatigue and chills and so forth. So definitely we are seeing that. I'll let Dr. Hess also elaborate.
I would say that, yeah, we are typically seeing that. I will say how recently you had the COVID also seems to be making a bit of a difference. And so that's kind of where part of it was a supply issue where they said, if you've had it within 90 days you consider putting it off. But also, I think there is a little bit of this, the more recently you've had COVID, it seems like those folks are having a little bit stronger reactions than people that say had it back in March or April. No one is, the hard part with this is there's no literature on this at all. So, you can't actually, it's all anecdotal right now. It's just going to be what we're seeing in our practices in our clinics. So, statistically, I can't say that you're more likely or not. I will say that what I've seen in talking to patients is yes, it seems like it is a little bit more likely to have stronger reactions if you've had COVID.
Okay,
And
very good.
the side effects are a little stronger on the second shot. So you get your first shot, then you get your second shot, and the second shot you react more than you did after the first shot.
Okay, so we'll prepare for that. Thank you, doctors. Our next question comes from Naomi. When you say people who have allergies might want to avoid the shot, what kind of allergies are you talking about? And second, do any of the vaccines, COVID, the flu, the shingles, interact with each other? And there's a third part to this question. Are there any medicines that interact with the vaccines that are contraindicated?
Well, I'll talk about first. Like, first off, there's no reason not to give the vaccine along with other vaccines. If you give this vaccine and delay getting other vaccines, all you're doing is making yourself vulnerable to the diseases that you would have been protected from with the other vaccines, and of course vice versa. So you want to get all the vaccines that you're supposed to get: flu shot, pneumonia shot, this, COVID, whatever it is you're scheduled for, Shingrix. Get those vaccines. Remember that each vaccine is made up of antigens. That is, the antigens are what are stimulating your body to create the rehearsal. And if you go out to a park, if you go take a walk in the park and you're breathing the air under the trees, your respiratory system is collecting hundreds of antigens, and your body's having to deal with that. So getting a COVID vaccine and then getting a flu shot and then getting Shingrix, that's just a handful of antigens compared to what you get just walking around the environment. So that's not something you have to worry about. And as far as allergies goes, as I said, if you have a documented allergy to the polyethylene glycol, to that laxative, to the Miralax, then yes, you're going to have a problem with this vaccine. Talk to your doctor before you get it. If you're somebody who's allergic to peanuts and allergic to shellfish and allergic to penicillin, and you have to walk around with an EpiPen all the time because you walk in some you could be very frequently in situations that you need to stick yourself with the EpiPen to save your own life. Talk to a doctor before you get the vaccine, and if you still want the vaccine, go to some place where they can monitor you closely. This is not casual monitoring. This is someplace where they have epinephrine on hand. They give you the vaccine, and then they're ready to pop you with the epinephrine as soon as you start having a reaction. That's also a possibility to do that. But that's where you certainly talk to your doc. Otherwise, if you haven't had, and if you're allergic, if your history of allergy is just a rash, okay, I eat strawberries and I get a rash from strawberries, let's say, no, this vaccine's not going to bother you.
Okay. Any medicines that are contraindicated? I'm sure when you get the vaccine.
Ibuprofen.
Okay.
Ibuprofen. Don't take ibuprofen because
that's the only one.
Rehearsal.
Okay, and then I'm sorry to interrupt you, Doc. Go ahead. We're new at this. The logical question would be then, I guess, to follow up for Naomi would be, you probably don't want to get the COVID, the flu, and shingles, 3 vaccines in the same month, maybe? You probably want to spread those out a little bit to give your body time to rehearse?
Nope. Okay. There's no reason to spread them out.
There's no reason to spread them out. You can get them at the same time. Okay, so that helps clarify it for our audience. Thank you very much, Doctor.
I think actually they are, in general, exactly what Ron's saying is true. You don't want to delay regular healthcare. You don't want to delay vaccines. I do think that they did actually, there's a week or two that you cannot get a vaccine around the time of because what they're doing is they're trying to monitor to make sure if someone does have a reaction, was it to the COVID vaccine or was it due to flu or pneumonia? So there is a time window. It's not because they're contraindicated with each other. It's just we're still doing surveillance to make sure that we're not, there's not some consequence of COVID vaccines that we're not aware of. Isn't that correct, Bayo?
That is correct. And when you register or when you actually arrive to get your vaccine, you'll have a form to complete, and it will ask if you had a pneumonia or anything like that. And that could make you not eligible to get the vaccine because of that.
I sort of remember in my mind, it's a 2-week, like 2 weeks. You can't, within 2 weeks, they don't want you to get another vaccine, but it's not because they're going to react to each other or that you shouldn't get them. It's actually so we can monitor for side effects.
Well, thank you for correcting me on that point.
Okay, building data, again, very important through this new process for us, a new pandemic, new vaccine, new process. Our next question comes from Rick, and it is regarding the vaccine. According to Dr. Fauci, the vaccine does not make you immune nor prevent you from spreading COVID. Rather, it makes you an asymptomatic carrier. So Rick's question is, can we reach herd immunity when there is no conferred immunity from vaccination and antibodies are found to be dwindling in a matter of months? Is that the case, doctors?
I could try to field that one, but I'd certainly want the other doctor's opinion. We still don't know. We know that it reduces the risk of having severe illness by 95+%. We don't know how much it protects as far as actually getting it and then potentially spreading to others, that sort of asymptomatic spread. What I will tell you is, so what Fauci is saying is correct. We don't have the data yet, but there is some preliminary data, actually, I think it was with the Moderna vaccine, where they did see significant lowering in people that did get it, were in the group that got it, that had been vaccinated. Their viral loads, okay, the amount of virus they had in them was much lower than the people who hadn't been vaccinated that got COVID. So there was but it wasn't enough people, because once again, they were trying to get the vaccine approved and out to say that it could truly reduce viral load. We know with other vaccines and other illnesses that when you get vaccinated, you still can potentially get that illness, but the amount of the likelihood of you then spreading it to somebody else, I think measles vaccine is a good example of this, is much lower, okay? So there's a presumption that yes, while we can't say for certain right now that it's going to help slow spread, it's felt by a lot of the experts that it is indeed going to help slow spread and certainly get us to a level of herd immunity much, much quicker than natural infection would. But I'll defer to my colleague.
Well, pneumonia, for example, pneumonia and flu vaccine are not guaranteed to prevent pneumonia and the flu, but they are pretty much guaranteed to keep you out of the ICU with a machine breathing for you. Wow. You get vaccinated like that, that's not going to happen. You're going to get your pneumonia. If you get your pneumonia, you're going to get it. You're going to sit at home. You're going to drink your fluids. You're going to take your antibiotic. You'll be fine. But without the vaccine, you could be headed for trouble.
And that's what I was going to add from the urgent care and emergencies. What I see when you think of like last year with flu vaccines and so forth, I had an 80-year-old lady who had received her flu shot and unfortunately contracted influenza A. I am positive that if she would not have received that vaccination, she would have been hospitalized. So I was able to discharge her, let her go home, and as we talked about, some fluids and so forth. But so it's a level of protection that at least allows you to have a better playing ground. I think it's the playing level, excuse me. And so that's something to think about when you do receive the vaccine, that it's going to give you everything you can to fight it versus not having anything.
Okay, thank you for answering, doctors. Our next question comes from Dave. My mother's a diabetic. Can she take her regular meds before getting the vaccine? I imagine right before getting it is diabetic is a daily routine.
Absolutely. Continue to take all of your regular medicines. Okay,
very good. There you go. Our next question comes, and for our audience, there's in the chat box, our experts have submitted some sites where you can learn more about the availability. There's a link through immunizenevada.org they've provided, so please take a look at that. And it's not perfect. I see some comments that people have been trying to sign up and it's been an effort and futility. So I imagine some of the logistics there are still being worked out. Doctors, can you talk about that a little bit, or do you have any understanding of that? Whether it's through MyChart or Renown or through Immunize, any of the links our members try to access, sometimes it's difficult for them. Any experience with that, or suggestions, recommendations for perseverance to our audience?
It is. It's very difficult. And I think we are just trying to do our best as we go. And I was on a government call today, and we really provided the hurdles that we are all going through. So we want to provide this vaccine. We want to get it in patients' arms, but there's so many different things just to even put on the clinic, as well as what happens afterwards. And so it's kind of a progress where we are having lots of bumps. And unfortunately, it has interfered with patients' access. I can tell you, even for my dad, who's 97 years old, and if I wasn't able to help him get an appointment, he would not have been able to do it. So these are things that I think you need to continue to put out in the universe, the issues that are happening, because it helps us as physicians and even clinics really fight and advocate for the need to have a better better workflow.
Very good.
And Washoe County Health Department just today released an update with those links for Walgreens and Smiths. So if you get on the Washoe County Health Department website, those are just, I'm encouraging people that are in that group that can get vaccinated, or even the 65 where you can get on the wait list, is sign up as many places as you can, and it's kind of like the squeaky wheel gets the grease. So just keep plugging along. It's going to get better. Our supply is going to improve, but it's still hit or miss. And like I said, what Washoe County got last Friday and what they get this Tuesday, you would think it would be a constant amount, but it is not.
Is it even the same vaccine? Is it different vaccines at different times?
Vaccines?
Okay, that helps me understand. And maybe you can answer this question. Is it a hindrance not having like a national software program to track and record the doses being administered, or direction on administration from a national perspective?
Well, other countries have certainly been more efficient and effective because of their information systems. For example, in Israel, healthcare is delivered by 4 organizations, HMOs basically, and you belong to one out of 4, and they all cooperate on the same kind of electronic medical record. So the Israeli health authorities have been able to vaccinate 1% of their population every day, pretty much every week. And by now, something like a quarter of the population has been vaccinated, and they're well on their way to finishing it all by the summer. And that's because they have an integrated electronic health record system that everybody belongs to, and they're very efficient about data collection and data dissemination. We don't do that here.
Okay, so the states are basically left on their own to come up with their own electronic P&Ps and procedure and policies, and then that filters down to the local levels, the counties and the townships and the cities, their own people. Okay, that helps answer part of the question why it's been so difficult to get the administration aspect out to our audience, who are the public who needs it. Thank you, Doctor. Next question comes from Russ, and it's, can you explain, doctors, why you need the vaccine if you've already had COVID?
Because the immune system, it's not clear that your immune system is going to give you good protection after you've had the disease. There are examples where the vaccines are more effective than getting the disease itself, and this is probably going to be true for the COVID vaccine as well. Getting the disease and then having an infection for a few months and then getting reinfected is not a good thing to do. And we have evidence to show that patients can be reinfected after about 4 months after their first infection. And so if you're going to expose yourself to that, then you're risking the long-term side effects of the disease itself. You're risking the pneumonias, you're risking the damage to the nervous system, you're risking the heart problems, you're risking the lung problems, you're risking the confusion and all the memory issues, and then you're risking dying.
Again, the risks outweigh the benefits.
That's right.
And I think conceptually it's hard for people to understand, like, well, why wouldn't native infection protect you as well as the vaccine? And I certainly understand sort of why in people's heads. I think what people need to realize is when we fight off an infection, our immune system, as good as it is, oftentimes creates a slew of antibodies. It's kind of like it just throws everything but the kitchen sink at COVID. And you would think, well, that's a good thing, right? But the reality is it's a very it's part of the reason why some people get really sick and other people don't, because some of those immune responses actually are counterproductive. It actually makes the person sicker. We're finding that a lot of the illness related to COVID is the body's over dramatic immune response and attacking parts of COVID that actually doesn't help protect them. The vaccine, on the other hand, if you think of it, it creates a very specialized immune response to the part of the COVID virus that allows entry into our cells. And it's really enhanced that part of the protection system. And that's why the vaccine is felt to be far, far more effective at protecting or preventing infection than actual native infection is. And part of the reason why native infection, unfortunately, for some people, is allowing them to get reinfected just months after having it the first go around.
Makes sense. Thank you. And this question hasn't come up yet, or at least I haven't scrolled down to it yet. Who pays for it? What is the cost of getting a vaccine?
It's free.
Federal government 100%. So there could be, as it gets rolled out to doctors' offices, they are allowing for an administration fee, which is usually not very, very much. Potentially, maybe pharmacies might charge for that. So, but the actual vaccine itself is free.
Okay. Some of our members have tried to sign up and they were asked for a social security number. Do you know, doctors, does a sign up or registration for an appointment require a social security number? Some of our members are fearful this could be a scam. Or there are scams out there, or there's pending scams out there.
I would be leery about giving my social security number. I know that the health department doesn't require that. I know that I don't think when you sign up for my chart through Reno, do you know, Bayo, does that require?
No, all of them have only required your name, date of birth, and email, and then an address if you have it, a zip code, and so forth. So I would definitely not provide your social security. I've not heard about that on any of the platforms.
Okay, that helps some of our audience understand that. Very important. So doctors, we've talked about a little bit about the manufacturing of the vaccine. The distribution of the vaccine, does that play a role with how it gets to certain states? Are there priority areas? For instance, is Southern California with a raging pandemic now, is it a higher priority? How is it prioritized, and who does that? Is it the CDC?
So my understanding, it was totally set up, prioritized by population. So they basically allocated vaccines strictly based off of that, off of population. Now that could have changed. We're not necessarily privy to what Health and Human Services, which oversees the CDC essentially, and they're the ones who are kind of managing the vaccine distribution. And it's one of the sort of kind of black boxes is like, how they're determining what states get what and when is not been as, I'll be honest, it's not been as transparent as it should be, and hopefully that gets better.
Okay, very good. When do you foresee, this question comes from Dave, being safe to go out after getting the vaccine? And I suspect this is in the general public, so you don't risk catching it or not having to wear a mask, or is there any good answer to that?
So Dr. Fauci has answered questions about that, and I agree with his answer. Here in Washoe County, I don't expect a significant improvement in the environment so that we can stop wearing masks and stop socially distancing until September or maybe October, because it won't be until June until the vaccine program really gets revved up so that a majority of people are getting their first shots. And then it'll be after that you see that you really see kind of improvement. We are seeing some improvements now in terms of the hospital burden is slightly less. We're not seeing the incredible surge that I expected to see from New Year's, although it has basically blunted the improvement. So there have been some increases, but basically it means that the improvement has not continued. I hope I'm wrong. Okay, I want to be wrong. Okay, when fast forward this video to May or something, I want some of you to call me and say, hey, you're dead wrong. It's much better now. Okay, nothing would make me happier.
Right. Great answer, doctor. Thank you. Where can our audience go to find the process, the prioritization of this, the tier 1, tier 2, essential, non-essential? Where can they go? The parallel tracks, 65 plus or 70 plus, to get to have more information? Is it on the state of Nevada? Is it Washoe County? Where is a good site for our audience to refer to, doctors?
Washoe County Health Department has those listed. So and then Immunize Nevada does as well. But Washoe County, I can't think what their website, but if you type in Washoe County, it'll be one of the first that comes up. And they've got a whole COVID page that you can click on, and it has all of those details.
And the other thing that they have on Immunize Nevada, they have a plethora of videos, which really could maybe answer even more questions, specific questions. Why should I trust this vaccine? And other FAQs that could be really helpful. And they are all recorded by local physicians. And so I think that provides some confidence in the answers and so forth. So I do encourage you to check out those videos.
So both Washoe County, COVID, and immunizenevada.org. Great sites to find that information out for our audience. Well, thank you very much, doctors. It's just about an hour into this. I've got one more question, I think, and then we'll conclude this. And I want to thank you very much and then give you a chance to wrap things up from your perspective. There's an anonymous attendee says, in Southern Nevada, I found helping others that the clinics held by UMC require Social Security numbers, and the SND, Southern Nevada Health District, don't. So it is confusing. So that was just someone offering a bit of information to us. It's not a question to you. So doctors, wrap it up for us. Take us home. The importance, the safety, the efficacy, why this is so important to having an open and full economy and full employment.
But we all want to get back to our lives, right? I personally have been living in my house, going out only for essential tasks, not getting a haircut, not doing the things that I like to do, meeting people by video, and starting to confuse, maybe it's all max headroom now, but I do want to get back to a normal existence where I can hug people and shake their hands and slap them on the back and like that. And we want to get back to that, and we want to open up the rest of the economy. We're not going to do that by all getting sick, losing 6 million people dead from the natural process. We're going to do that by all getting vaccinated as quickly as possible, as efficiently as possible, getting this over with, and then we can go back and start living a more normal existence. And I want to do it as soon as possible.
Very good. Dr. Bayo Curry Winchell, Dr. Hess.
Okay.
Anything?
I echo what Dr. Aryel stated. I am hoping we get to return to a sense of normalcy. For those, participants who have kiddos, I have 2 little ones, and I want them to be able to, just return to what life used to be and having the play dates and just normal life and so forth. So I am hopeful that we will achieve a level of immunity with everybody's buy-in. And I think that's the biggest thing. All of us are in this together, and I know we're tired of hearing that, but if we could really just get vaccinated and do what we can, we will get there. So, but those are my thoughts.
Great thoughts, Doctor. Thank you very much. Dr. Hess, anything to add? Because I feel the same way. We're societal, we're social beings. We want to be together. And I'm tired, for one, of being on Hollywood Squares every week here. Not that I don't enjoy seeing your faces, but I want to do the same thing, see people in person. So Dr. Hess, anything?
I would just echo what both my colleagues have said, is that, I remember when this started, I love going to sporting events. I love going out to eat, and I love going to movies. And so it really hit me right a sucker punch. And I truly believe we're going to get there. I think the vaccine is by far our quickest way out of this mess. Otherwise, we're going to continue to have these waves. You know, as soon as your time comes up, and if your time is, if you're one of the lists now, be that squeaky wheel, keep signing up, try to get that vaccine. Because the more people we can get vaccinated, the quicker, the sooner we're out of this.
Great. Well, doctors, I want to thank you all from the bottom of my heart for having this webinar for us. It's our first time doing this. I think the audience, the comments at the end here are very grateful to you. So take a look at those. I want to remind our audience that you can find us at NNCLC.org. That's North Nevada Central Labor Council.org. We will post all these links. And we've recorded this video for future education. We'll end up, our comms director and our team will take a look at it. We may edit it out a little bit, but we want to put it out there for anyone else that has these type of questions. It's so important that the community get some answers and relieve some of that anxiety or apprehension they may have about getting a vaccine, which will get us to a healthy, full economy and back to our social, regular lives. So thank you very much. I appreciate everything and appreciate our audience for all their patience. It's been a great evening. Thank you. Again, thanks to Sarah Mahler. Big shout out to her for helping us with this, connecting us. Rob, anything to add? Wendy? All right. That concludes, doctors. Thank you again, everyone. Have a great night, everyone. Appreciate all the input.
Take care. Stay safe.
Stay safe. Get vaccinated. Sign up.
Yes.
All right. Good night, everyone.
Good night.